Okay. So let's look at this. This is pretty self-explanatory when we get into it. These 5 stages, and these are good test questions, by the way. I mean, they're not really good, but they are decent. You'll see these again, the 5 stages of grief. Everybody grieves. I don't know if you guys have lost grandparents, or you've lost people that people have died in your lives, right? So you have a grieving process. So do patients. They have a grieving process. And these are just the 5 steps of it. Denial. And let me back up and tell you that all these are unhealthy. Acceptance is really the only healthy stage that we want to get in. We have to get to that stage, right? We have to get to the healthy stage. But you denial, not me. Why me? It can't be. Yes, it can be. Because they're dead. It is you, right? You can't deny that. So, and I'm not being harsh. I'm just trying to show you a realistic way that these are unhealthy. You can deny it all day long, but it happened, right? We can deny that summer has come to the end, right? I was in denial when I had to come back to work. It can't be. It can't be. Yes, it can be. You can't live in denial. You have to move forward, okay? Why me? Why? Why me? Why do I have to go back? Why not you? Right? Why not? It happens to everybody. Probably one of the most unhealthy one is you try to bargain. Okay, but first let me do this. Don't, if only, Grandpa Jones was still around for another day or another week, I would spend more time with him. Right? I can't tell you how many times I've heard that they're angry. They get angry. They're angry towards me. By the way, if a patient gets angry at you and you did nothing, they're just angry. They're just venting in the direction of someone with a pair of scrubs on, right? And so it has nothing to do with you. But they make these bargains, and I don't tell this to patients because it would only throw gas on this one. But you shouldn't go through this stage if you take care of your business while people are still alive, right? So if you want to spend more time with mom and dad, do it while they're still alive. Don't have regret and try to make bargains when it's too late. That's a big thing, okay? Depression, and this is not feeling bad or feeling sad about the event, right? Depression is clinical depression almost, where you can't get out of bed. You don't feel like doing anything. If I laid in bed and I didn't get up, and my wife came in and says, "I've got some bluebell for you. You want to get up and eat some bluebell?" No, I want to lay here in the dark. She called the psychiatrist. I have a problem, right? So don't get me wrong on the depression part. It's okay to feel sad. It's okay to have empathy. It's okay to do these things. But where you're so depressed you can't function, that's just not a healthy place to stay. I'm not saying that you're not going to stay in these 4 areas a certain length of time, but you can't stay there for long periods of time. It's just not healthy for you. We have to get to the level of acceptance, and then from that acceptance, move on. Right? You got to move on with it. I'm not saying that it's easy. I'm just saying that you have to do that because things are not going to change. So that's you're seeing as we work through the class. I mean, you're going to see this, and it's just going to be a bad thing. But some people just can't get out of this mode. These areas here where it's really harmful for them, and let's move to acceptance. And you may need help to get to that point, right? You may need help to get to the point of acceptance, and that's okay. You know, counselors are good. People are good. The person that you trust that you can talk to is good to help you get through this. And so, do recognize the patient's need. Be tolerant, because they're going to have angry reactions. Like I said, it's not angry at you. They're just angry because what happened. Listen empathetically. I can hardly say that, but you can have empathy, right? You can have empathy towards somebody. So listen to them. Just don't get tied up. If you're in the room and bad things are taking place or took place, and a family member comes and they want to talk, listen to them. Don't interject. You know, listen to that family member. Listen to that person. Here's what. Let's see if this has happened to you before. You have a problem, and you're trying to talk about your problem, and you're talking to a friend, and that friend then compares your problem with their problem that they've had before. Right? So let's say Uncle Bob has passed away, and you're having some difficulty with it, and I come up and say, yeah, Uncle Bob passed away. I'm just having difficulty with accepting that. And then your friend comes along and says, yeah, I remember when my uncle passed away. It was horrible. It was this and it was that, and I did this and I did that and I did this, and yada yada yada. Right? What's the common word in there that your friend's telling you? I. Now they're reliving their problem. They're not focused on your problem. Right? Does that make sense? They're focused on their problem. They're interjecting their situation that they had with yours. I'm not saying that you wouldn't use it by comparison, but you're no longer listening to the person that's trying to talk about their problem, because you're talking. People talk way too much when it comes to helping other people. They don't sit and listen. That's the issue. You have to sit and listen to that person. And don't put yourself in there. You know, this. You see what I'm saying? There's people who do that all the time, and all of a sudden now they're talking about their problem. So much for yours. Right? So don't ever give false hope or assurance. If you don't know what to say, don't say anything. Okay? You probably won't be in this situation, but don't give false hope. Like when I was doing CPR and people out in their yard, you know, they're saying, hey, are they going to make it? The last thing you want to say is, yeah, everything's going to be okay. Because that's not the last thing. You're going to get your head bit off during that. All right? I tell people, I said, this looks really bad. This is really bad. You need to, you know, collect the family. It's not looking well. Their heart's not beating. I'm doing compressions. I'm their heartbeat right now. But this doesn't look good. So be prepared for that. Right? Don't give false hope. Don't ever tell anybody it's going to be okay. Even if you're giving them assurance, let's say we're back to talking about Uncle Tom and passing of Uncle Tom. Don't tell them it's going to be okay. How do you know that? What is that? That's an assumption that everything's going to be okay. Don't do that. Don't say this will pass. This will be okay, because you don't know that. All right. So make sure that you keep focused on, if you're in this process here, you keep focused on what their needs are. Right? This is not the family member that just lost a loved one. You know, a husband just lost his wife of 60 years or whatever, right? Let's not make it something about us. Let's be empathetic with them and try to comfort them, okay? You probably won't be put in that situation by yourself. You may be along with a nurse or somebody that does that, you know, but you shouldn't be put in that situation by yourself. So stress management. hey, we all need this. Recognize the signs. Guess I'm pressing the wrong button. Recognize the signs. Lifestyle changes. Sort of what I was talking about. Okay, you get this guy that's now a people person. They're isolated. You know, you get this guy that's usually easy-go-lucky and he's slamming doors and kicking the cat on the way out the door. Right? Just he was happy-go-lucky, and all of a sudden he's really grumpy for a long period of time, and you're sitting there going, what in the world? Okay? This is where I get your hobbies from, and I'm asking you about this. Balance work, your job, the thing that you're getting paid for, with some sort of recreation, and then family time. Okay? My immediate family. So I balance. I play golf with my sons. It's very relaxing. Okay? I enjoyed it all the time. Even the time that on Sunday that we were playing poor golf. I still enjoyed that immensely of getting out there, right? It's a good balance. I didn't think of this place one time. Right? School, work, never crossed my mind. If it did, the only thing that crossed my mind was I won't be able to play golf Monday because I'm at work. Right? Okay, so a balance there. It's a balance. These are common. A balance between your work, your recreation, and family. If, honestly, right now, I'm probably out of balance because I played golf all summer, and I think about golf all the time now. Right? It'll balance itself out eventually, okay? So have a good balance there. Exercise. Do you think exercise relieves your stress?
Yes.
Does it? It help? Okay, good. Good deal. I don't exercise to relieve stress. Exercise stresses me out. I'm tired. I'm old. Give me a break. I exercise, I'm tired. I don't feel better after I go to the gym. I feel worse. It takes me a couple of hours to feel better. Okay? Get some Cheerios in me. Get some calories in me. Then I start feeling better. Alright? Big thing that you notice changes in work environment. Watch for these changes. It's very important when we look at that. And then, hey, if you can't get this under control, if you can't balance it, then seek professional help. There's nothing wrong with that. We put a sort of what do they call it? Like taboo. Oh, you're seeing the psychiatrist, okay, or the counselor, right? You have to see that. We put this stigma on that. But I'm telling you that you shouldn't do that. I've known people, friends of mine, rock solid, hard, how are you going to break this guy type person, you know what I'm saying? And man, they found him in the field one day with a gun, and he was thinking about pulling the trigger, you know? We live in this state, in just opinion, okay? But I think we live in this state where sanity and insanity is a fine line. It's a fine line between, especially in healthcare. Okay, there's a fine line between the two, and most of the time, if you're seeking professional help, you just need the person to tell you, not fluff, but to tell you the right thing, just to get you going and back in a more positive direction. Right? You just need that little push, like, you're going the wrong way. Let me guide you over here. Right? And by the way, I have no psychological training whatsoever. Okay? But I can help you with some of the things that you can do, but that's only because I probably experienced them. Right? Be careful with your advice. I'm very careful with my advice, or I try to be, because I'm not sometimes I just don't know what the right things to say are. so I don't say anything. The people that do this for a living, they know the right words to say. We were transporting this guy. He was having flashbacks from Vietnam, right? He's an old guy. And my partner said, hey, he had a lot of anxiety. My partner said, hey, tell me about the war. What did you just say? What did you just say to him? We're transporting him because he's having problems with that. And now you want to bring it up. Right? So, not such a great thing. So be aware. Like I said, we won't put you in situations like this in clinical rotation. But the only thing is they may think that you're a healthcare provider. They may think you're a nurse. So make sure that if they start like telling you all this stuff, like, hey, let me get your nurse. I'm not a nurse. I'm a high school student. I've had to tell tons of people that. They're giving me the eye because I'm just sort of standing around. I'm not doing anything. They're looking at me, and they come up and ask me for something, and I'm like, okay, I can get you maybe a blanket, but I don't work here. I'm a teacher. I teach these other guys in dark blue scrubs. I have to remind people all the time that I don't work there. I can help them with directions and things, but getting the medication, I can't really help them. I have to go tell the nurse. So you'll be the same way. They mistake you all the time for the nurse. Males, they mistake you all the time for the doctor. They just look at your age, though. They would know, wow, you're a young-looking doctor. But anyhow, right? All right. So questions there? We'll work on it. We're not done, but we won't spend an exorbitant amount of time talking about stress and things. We will, as stress builds in the class, we'll talk more about it a little bit. BSI, body substance isolation, is one thing that causes stress. I had a guy drop out of an EMT program that I had because he was afraid of getting some blood-borne pathogen. Right? It's like, I'm not going to eat with my hands because I'm afraid of a germ, ingesting a germ. Right? We don't really fear these things because we were prepared for them, right? We use caution. So here, body substance isolation, BSI, is your basic I'm not messing with that mouse. You presume that all body fluids are infectious. Everything is infectious. Okay? If you're working at the hospital and you come over here and you put your hand down here and it's wet now, right? You put your hand down there and you put it in something wet. Okay? What is that you just put your hand in by the sink? Huh? What do you think it would be? Water? That could be. It's by the sink. It could be water, right? That's reasonable. Or it could be urine, right? Now you have urine all over your hands. I mean, you just don't know. So you presume that everything is infectious. So if I sit there and I put my hand in something wet, I'm going to go wash my hands, like right then, or as soon as I absolutely can, which would be, if it was not a life-threatening emergency, I would put everything down and go wash my hands, because I don't know what that was. It could be anything. It could be urine, because urine's supposed to be clear, okay? Urine is not supposed to be this discolored yellow or orange stuff. That's just telling you don't drink enough water. Okay, it could be spinal fluid. It could be anything. Right? So we presume that everything is infectious. The other thing that you're looking at, just a little bit different word, is personal protective equipment, or PPE. All right? Gloves is the basic form. Gloves is the basic form of protection. When we have body contact, or patient contact, we wear gloves the majority of the time. All right. If they have some other problem, if they have droplets, if you suspect them maybe TB or something of airborne droplets, then we would wear a mask, a HEPA mask, HEPA mask, or respirators. Okay. Circle that, because you're going to need to know that for your PCT exam. Okay? So if you felt like this person had airborne droplets, let's say TB or something, you may want to wear a HEPA mask. I mean, that's a higher form of protection, but at least a surgical mask. So if you have an airborne flu, airborne, right? So patients with potentially the flu, you're seeing them all the time at the hospital, they put a mask on them. If they have a cough and they're running a temperature, then they put a mask on to protect other people and the healthcare provider from airborne droplets. Remember the spit zone? We talked about the spit zone, right? Yes. You guys are in it right here. Welcome to the spit zone. So airborne droplets, a mask. If you think that there's some type of splash protection that you need, like blood or something, you're suctioning or something, you don't want anything to splash in your eyes, then you need to wear eye protection or a mask. Sometimes they come together, that little surgical mask with the shield on it. You'll see that if you ever do CPR on somebody, you put a mask on, you have to do it with that. Because the way that we don't want airborne droplets coming out of the endotracheal tube or something, right? Or when you're breathing for them. Gowns here as well, if they're in contact isolation, all right? So if they're in contact isolation, means that you don't want to touch that patient, right? Whatever it is, contact, you want to wear a gown. If you get down to the gown, then you're wearing the face shield and the gloves, right? You always wear the gloves. But then as these are just different levels of protection, like C. diff. Have you ever heard of C. diff? It's like C, then diff, D-I-F-F. The word's about this long. I can't say it. All right? But C. diff is a gift that keeps on giving. When you come in contact with C. diff, it's using patient's poo, okay? But other contact isolation, you get it on your hand, you get somewhere. C. diff can live on surfaces for days. Unlike blood. Blood can't live on surfaces very long. C. diff can live on hard surfaces for a long time. And it causes violent diarrhea and nausea. The side effects are harsh. So if you have a patient contact that has C. diff or something, TB, you still don't want that stuff on you, those droplets, then you would probably wear a gown. You guys, more than likely, if the patient is in isolation, they're not going to allow you in the room. And you don't need to be in the room. Don't go in the room with someone with TB. You don't get paid enough. Right? Stay out of there. I'm not going in there. So stay out. And you'll see that this patient's in isolation. They may just have bed bugs, and they may be isolated. You don't want bed bugs on you. So just keep this in mind. But for now, no. The basic BSI is your gloves, okay? And then each step after that. They don't really make latex gloves too much anymore because of the allergies. They just make them all non-latex, all right? And then face shield, eye protection, and gown. So the personal protective equipment is just the list. This is really cool.
Infectious diseases are caused by microscopic organisms.
That didn't work. Oh. Well, I'll find it later. I guess you're out of the cool thing. This was where this germ was being attacked by an antibiotic. I'll find it. I'll show you later. It's really neat. This is not as cool.
Infectious diseases are caused by microscopic organisms, including bacteria, fungi, parasites, and viruses. Certain bacteria, for example, are responsible for diseases and illnesses such as pneumonia, meningitis, strep throat, and wound infections. Ways that infections can enter the body are through skin contact, respiratory droplets, and ingesting contaminated food or water. To help stop the spread of germs, use a tissue to cover nose and mouth when sneezing or coughing. Avoid touching eyes, nose, and mouth. Wash hands often. Hand washing is one of the most effective ways in preventing the spread of infection. Some important times to wash include before preparing, serving, or eating food, after using the bathroom, after sneezing, coughing, or blowing nose, before and after treating cuts or wounds, before inserting or removing contact lenses, and when visiting a sick person. For proper hand washing, use warm water and liquid soap. Rub hands vigorously together and lather well. Keep hands pointed down. Scrub all surfaces, including palms, back of hands, and between fingers, for at least 15 seconds. Rinse well. Pat dry with a clean disposable towel. Use another paper towel to turn off the faucet. Alcohol-based hand sanitizers may be used as an alternative for times when soap and water are not available. Make proper and frequent hand washing a habit.
Hand washing is huge as far as that's the number one way to prevent the spread of germs and bacteria and everything, all right? Is wash your hands. Now again, I'm not a germaphobe, right? I'm just not. There's healthy germs that we need on our skin, right? In our gut and everything. There's healthy bacteria. But you have to make sure that you are aware of these. And we'll go into it a little bit more later. But you'll get into the habit of knowing what you've touched. Are my hands clean or dirty? They look clean, right? But they're dirty. I hadn't washed them. Okay. When you go and we learn to wash our hands, it's like for 20 seconds, but I think it's the thing where you say the ABCs, right? As you wash your hands, so you get your hands wet. You put the soap on. You move your hands away from the water so you don't wash the soap on, and then you rub them between your fingers like the video and around your wrist, especially. For some reason, around your wrist, that's where staph likes to live. So you wash around your wrist and between your fingers for the alphabet or about 20 seconds or so. Then you rinse with as hot water as you can stand. Why do you push the thing with the turn it off with the towel? Right, because if you touch the faucet handle, now whatever hand you use is contaminated, right? So this hand is dirty. What do you do if I walk over here to the door, touch this door? Hand clean or dirty? Dirty. This hand clean. So I'm not going to walk over there and touch that door, then go in my office and eat a cracker with this hand, correct? Because I just picked up the cracker and I did this with the dirty hand. Does that make sense to everybody? So be aware that there's, as you open the door, then toss the paper towel or whatever you have. We don't use hand dryers anymore, right? You guys still use the hand dryers? Because the poo that comes out of them, they're full of fecal material. We don't want to blow fecal material back on our hands. But you be aware of, after you get used to it, of the things that you touch, just like the eye, right? My eye itches. Oh man, it itches bad. Am I going to put this finger and itch my eye? Why? Why not? Why not use finger to itch my eye? Because it's dirty. I don't know what's on the finger. Right? So I rub my eye, and all of a sudden the next day I have this big red looking nasty eye. Well, because I probably rubbed it with the dirty hand, right? So my eye itches like crazy. I need to itch it, so I'm gonna wash my hands and then rub my eye, right? So anyhow, you sort of get as we work forward. We'll talk about all the different ways that you want to make sure that your hands are clean. But hand washing is the number one way to prevent sickness. We get sick a lot. Okay, people get sick a lot during the cold and flu seasons because they don't maintain their proper hand washing. And also they get in front of people face to face instead of off to the side. You're in a big group, whatever, and you're shaking each other's hand. You ever heard of shake a hand and spread a cold? Yeah, because you start shaking people's hands, and then all of a sudden you start eating and rubbing your face and rubbing your eyes, or you get these things around your face like you have. Okay, I mean, you're just being sort of comfortable with here, but notice how close your hands are to your face. What's on your hands? Germs, bacteria, blah, blah, blah. Right, now you got it really close to your face. Old boy just left your hands and went on your chin now, and he's making his move towards your mouth. Right? In order to get inside your body, they need a way in. Okay? So think of the ways in your body. In os, O-S. What's os mean? Y'all know that? Yeah? Yeah, I haven't had that abbreviation yet, or prefix. OS means os. Well, obviously I just said os, which is a whole. Per os means by mouth, or by, take it by mouth, it's per os, right? So you think of the ways that's a portal inside your body. Your mouth is one. What's the other portal? Yeah, an open wound. Ears, nose. If you're going to pick your nose, do it with a clean finger. Wash your hands and pick your nose. Okay? Y'all pick your nose, right? How do you get those boogers out? You try to blow them out? What do you do if they're stuck? A Q-tip? Do you really put a Q-tip up your nose trying to get a booger out? Pull it, pick it out. Have you ever wondered where a booger comes from? I mean, because the nasal, the hairs in your nose, everybody have hairs in their nose. The purpose of the hair in your nose is to filter. So we breathe in dust and particles all the time. So it catches that. It catches all those dust and particles, and then on the inside of your nose, if you would pick it more, you'd realize that it's moist. Right? So dust and moisture makes a little dirt clod, right? Or a booger. Right? We have a lot of body fluid, so it keeps reproducing. You'll be more comfortable with that later. Well, you guys don't pick your nose. Okay.
The chain of infection is an interactive process that involves an agent, such as bacteria, viruses, or fungi, a host or person, and the environment. There are 6 essential elements or links in the chain for the transmission of microorganisms to occur. Breaking the chain of infection is achieved by using preventive measures to interrupt or block transmission of microorganisms at the critical links in the chain. An infectious agent that is capable of causing disease is the first important link in the chain of infection. To break the chain, do a thorough cleansing, and then follow with disinfection. Always use proper hand washing. The reservoir or source is where the agent lives and is the next link in the chain. A good example of a source spreading bacteria is a cat and its saliva. As a cat grooms itself, it spreads the saliva. To break the chain, keep your skin intact, as it serves as a barrier to infection. Wash hands. The mode of transmission is the process that bridges the gap between the portal of exit of microorganisms from the reservoir or source and the portal of entry to the host. A cat scratch is a mode of transmission known as vector-borne. This mode of transmission also includes bites from mosquitoes, ticks, lice, fleas, and other animals. To break the chain, wash your hands, then gently wash the scratch and surrounding area with soap and water for 30 seconds. Apply a clean or sterile dressing. Repeat hand washing. A susceptible host is a person who is vulnerable to disease and the final link in the chain of infection. To break the chain, a well-balanced diet, exercise, sufficient sleep, and good personal hygiene is essential for maintaining an intact immune system. By using preventive measures at each critical link in the chain of infection, the interactive process involving agent, host, and environment is altered, and the possibility of disease is avoided.
Closer. Yeah. It's almost 100%. I thought you were taking notes, but that's somebody else's work. School. Class. What did you guys not do in the video? Take notes. Are you going to remember that as a test question? Like when you see, what is it, 6 chains, 6 links? So when I write down, list the 6 links of the chain of infection on the exam. You guys don't remember that without notes? I'm picking on you. But yeah, but you know, are you? So what should you do? Take notes. That was pretty fast though. I went through that information pretty fast. So you don't have, let's say you don't have adequate notes. Don't worry. I have the same conversation every year. Okay? So when I show a video for entertainment, you'll know it because it'll make you laugh. No laughter there, right? So not for entertainment. Or I'll tell you, hey, you don't need to take this just to make you laugh. Right? So now you're past the point. You don't, because we're going boom there, right? So just like, man, I don't have those notes. What do you have? What should you do now? What can you do?
Start taking notes.
Well, I mean, what are you going to do about the notes that you don't have? Well, I can tell you that he tried, but he gave up.
I went through 1 through 6.
So what now? What do you do now? You guys are smart. What do you do? You know you just missed the whole video. What can you do? Where at? Where you know rewatching?
Search it when you get home. Try to find it. When you get home, try to find it so you can watch it and get notes.
Yeah. If the video was over 6 chains of infection, then since you don't have the notes or adequate notes, then I would Google as your friend. Okay? So you would have to Google six branches or 6 chains of infection, right? To pick those notes back up. You see that method? Otherwise, you can find the video YouTube, right? Where you find, but that's going to happen because some of the videos that we watch go pretty quick. So either you're going to have to write like a mad person, or you're going to have to make notes. So what I would do if I was taking the notes, like you guys, right? If I was in your seat, what I would do is I can't keep up with that video, right? So I would just write down the topic, six chains of infection, boom. And I would go home and look that up. I'd put a little star or something by it, or if I have highlighters like you guys do, I would put 6 chains of infection and highlight that to make sure that I go back and I look that information up, okay? You get it? You get that? Okay, so I'll help you along for a while with this information. Okay, so, but you will need to go back and find that. But make sure you're taking notes on the video, right? Okay. A lot of people get hepatitis B. We have a vaccine now that you guys have to have in order to come to school. So you have to be vaccinated against hepatitis B. Hepatitis, any of the hepatitis B, C, A, all those are affect the liver. And hepatitis B lives on the surface a lot longer. You know, a lot of people are sort of, maybe not so much anymore, but they're a little scared of AIDS or HIV, right? But HIV doesn't live outside the host very long. So it's harder, very hard to get HIV. Hepatitis B lives outside the host for a good while. I don't know the amount of time, it's really not that important, but you have to remember that hepatitis B does live outside the host. It's just like this big, and I forget which sickness it was. A few years, it was a good time ago now. This sort of virus came out, and everybody was freaking out about this virus. Okay, I mean, they were shutting schools down and cleaning all the desks, and they would do this massive amount of cleaning and all that. And it turned out to be a big cold. It wasn't really as bad as what everybody thought it was. But they would, they would shut schools down during the week and do all this, or go in on the weekend and do this massive amount of cleaning, when really all they had to do was just lock the doors and don't let anybody in there. Well, that's not hard to do in school on the weekend, right? Keep people out. Because even if I hack one up right on the desk and I left it there and went on the way, and I had this sickness in me, it's going to be dead by Monday. So that's what they didn't look at when they were shutting all these schools down and doing all this cleaning, was for the fact that all they had to do was leave it alone, leave the virus alone, and it died. It died within, I think, in a day, without the host. The host is us, right? So it died without the host. So just lock the doors, come back after it's dead, and then we'll be okay. But they just didn't understand that. How long does it live outside the body? That's the same way with the airborne droplet. How long does it float in the air? Right? I've been exposed to TB. I probably walked through a fog before, right? I mean, those airborne droplets they just don't come out and fall like a meteor to the floor, right? They sort of float there a little bit and then sink down. So if someone sneezes and you walk through the aftermath of their sneeze, then it's probably those respiratory droplets are still in the air. And this is what we'll learn later on. We'll talk about how to avoid these things because we want to stay healthy, right? So we'll talk about how to avoid these different things. Viruses, we should just know this through life. Viruses, bacteria, okay? So you have a viral infection. What's a flu? The flu is a viral infection, okay? So if you don't catch the flu right away, catch it, like get on top and go to the doctor right away, about after 2 days, it has to run its course, right? Because we don't take antibiotics for viruses. What do we do for viruses? Besides suffer. How do we treat a virus? Like the flu.
Get vaccinated.
Hmm?
Get vaccinated.
Yeah. Well, that's a prevention, but let's say old Steve here has the flu. What are we going to do for Steve? What? Yeah, but can't really isolate with the flu. Everybody would say locked up. You said give him medicine. What kind of medicine? Only if you catch it quick. If you don't catch it quick, then that virus is multiplied too much for the antiviral to work. Like the Tamiflu, that's $100 for 5 pills. Okay. So what are we going to do? How are we going to treat Steve? Close. Yeah, so you treat the signs and symptoms is what you're saying. Yeah, you just have to treat the signs and symptoms. Steve's going to have to run the course, let this virus run its course, treat the fever and the body aches and everything, treat the signs and symptoms, okay, for a virus. What about a bacterial infection like strep or some other thing? Antibiotics. Right? That's why they do that strep test in the back of your throat. You wake up, or let's use Steve again. Steve woke up. It hurts to swallow spit. He feels like his throat's swollen up really bad. He goes and looks in the mirror, and he has all these pus pockets back there in the back of his throat. And he goes, "Oh no, I could have strep." Goes to the doc. Says, "Doc, it hurts to swallow spit." Look. He goes, "Yep." Swabs it. Does a rapid strep. And comes back and says, "Yep, you have strep." There's 14 kinds of strep, but you have strep. Okay? And they give them antibiotics. The only other way to confirm that, really, if it hurts to swallow spit, you have these big pus pockets in the back of your throat, and you have strep breath. Y'all know you've ever heard of strep breath? It's the worst breath smell in the world. Like when you wake up in the morning, your breath is bad because you've went all night without water and a mint, and I mean it's just really dry, and you have that morning breath, right? And that's what cracks me up about TV. Now, let's say you have mom and dad, they're in the bed, and they wake up and they roll over and go, "Oh, good morning," and start kissing on each other, right? And everybody's like, "Come on, man. Brush your teeth first. Don't breathe on me." The worst morning breath that you could ever imagine, multiply it by a gazillion, and you have strep breath. It smells like someone just ate some poo or something. I mean, it's horrible, horrible smell. Once you smell strep breath, you go, "Oh yeah, you have strep." You know, you either have strep, or you need this whole packet of mints. Just eat this thing, right? All right, so they need antibiotics when to fight this bacteria. Now there can be both, like in pneumonia, meningitis, viral and bacterial. So they determine which one they have in the course of treatment. It does no good at all to give antibiotics to someone that has a viral infection or a virus. You just have to treat the signs and symptoms. Other things you get into is pathogens. You know, you just put the word together, patho, suffering. I think that's funny because we're going to do a lot of pathophysiology. So we're going to do a lot of suffering, learning how things work. All right? And then the other form. And so these are spread through exposure through airborne droplets and body fluids. All right? Here's a bit of useless trivia for you, okay? But I find it hilarious that all the germs and all the bacteria that are out there on the surface. I mean, there's bacteria and germs on the surface of your desk right now. You just can't see them because they're microscopic, right? And so there's stuff all over this place. every chemical, including the hand gel that you have and the soap, every form of germ and bacteria, to kill it, you need what's called a dwelling time. So that means that whatever you're using to clean that with, it has to stay on your hands. Let's say you're trying to clean your hands. It has to stay on your hands a certain amount of time. It has to have a dwelling time, or it's not going to work. So the thing that cracks me up the most, I go to Planet Fitness, right? And they have all these spray bottles all around the place. Or any gym, you know, they have the spray where you wipe the sweat off, okay? And every time, it could be dry, like there's not even sweating, and they come over here and they wipe it off, right? But they either spray it on the towel and do this and walk off, right? Or they come over and spray it right quick and wipe it dry. Everything requires, every substance, every chemical requires a dwelling time in order to kill that germ or bacteria. So what they really need to do, they need to spray it. Whatever they're spraying, they need to leave it on there, which is 2 or 3 minutes, depending on what you're using. Like the chemicals you guys will use in the hospital to clean the beds, the dwelling time is 2 minutes. You have to leave it wet for 2 minutes, and then you put the sheet on it, right? The hand gel, and I don't know what the dwelling time is, but the instructions put the hand gel on, and they say, you know, where it, they use a word, but they say where it's, I mean, you can see it, right? You can see the gel in your hands. What's a good word for that? Where you can, like, means a lot. Generous, right? A generous amount of hand gel where you can see your hands sort of glowing wet, right? And then you have to leave it on there until what? It's dry. What does most do when they put hand gel on? They do this until it's dry, until you rub it dry. You leave it on there until it's dry to give a dwelling time. Okay? All chemicals are like that goes with germs. You wipe it on, and you have to wipe it where it looks wet, and then you walk away and let it dry to give its dwelling time to kill that bacteria. It doesn't instantly kill the germ. I mean, if you use the hand gel and you're sitting there and you're doing this and you wipe it dry, that germ is sitting on your hand going, ah. Now he could start over here on your thumb, and as you're rubbing, you probably rubbed him over towards your pinky, but he's over here now going, whew, thanks for the drink. Thanks for that alcohol. Ooh, make me go blind. Yeah, but it didn't do anything. You didn't kill it because you didn't give it enough of the dwelling time. That's important when we want to stop the chain of infection, right? Okay, so we already talked about hand washing is the number one thing. Wash your hands. Change your gloves. Wash your hands. Or use the chemical hand sanitizer they have in the hospital. It's much better than alcohol-based. Okay? And you want a generous portion and get your hands wet, and then, but eventually you're going to need to wash your hands. If you come across someone that has a contact isolation, you want to wash your hands with soap and water. We'll go in more of a hand washing and everything a little bit later, but definitely wash your hands. And the other one is OSHA. Circle or put a little star by OSHA. If I was more prepared, Occupational Safety and Hazard Association. We'll touch base back on OSHA. But OSHA, one of the PCT questions, OSHA is responsible for safety in the hospital or in a healthcare setting. So anything to do with safety, OSHA is responsible for it. And OSHA is the one that does the infection, one of many that looks for infection control issues. Okay? But their fines, OSHA's fines, start in the tens of thousands of dollars. So we'll talk more and more about OSHA. We'll talk about them a little bit later, not too much, but just when we talk about the regulatory agencies that control the hospital, then we'll bring back up OSHA. You can't live today without knowing about HIV, right? It's been around way too long, and so they really make it remarkable. I don't think they've cured it, but they've really almost cured it. You have to take a lot of medicine, but it's not as bad as what it used to be. Direct contact with non-intact skin or open skin, right? When I work in healthcare, I don't work with my hands. Okay, I'm not mechanical at all, so you don't ever want me to try to fix something. But I never really work with my hands because I don't want any open sores on my hands, because I worked around infectious material with my hands. Okay, so be aware of these open sores and stuff on your hands. How can you tell if you have a little bit of paper cut or something? How do you know that? Yeah, when you put that hand gel in there that's alcohol based, you know where the paper cut is, because it burns. Right? So just be aware. Something to be aware of. It's nothing to be freakish about, but be aware. Hey, I've got an open sore in my hand. I'm going to make sure, double make sure that I either put a covering over that. I used to have an iguana that bit me one time, and bit me hard on my finger, left a mark. I work on an ambulance, so I went to the hospital and got this special sort of finger bandage to put on it, right? I knocked my iguana unconscious, but for biting me. But I was aware that I had these open sores on my hand. So be aware of that. Make sure that you have a conscious effort that you know that, because any small, a red blood cell is pretty small, right? And so you don't want to take that risk of getting an infection. A lot of this stuff with these contact isolations, airborne isolations, you don't have to be super sensitive about it, right? You just have to be aware. Hey, it's the cold and flu season. I'm going to stand to the side of people instead of in front of them. And you know the flu season's year round now, right? So you're going to be aware of that 3-foot spit zone. So I'm not going to stand in front of this patient. I'm going to stand to the side of them. A good rule in the hospital is if you're in the room with the doctors or nurses and they have on gloves, then you have on gloves. When in Rome, here's the Romans, right? Yeah. Okay. That's good. Hep B, we've already talked about that. It affects the liver. All the hepatitis. Hepatitis C affects the liver. Hepatitis A, have you ever heard of hepatitis A? They have a vaccine for it. I highly recommend that you get it. It's most people get hepatitis A eating fast food, restaurant food. It comes from the restaurant workers not washing their hands properly. So you have these others. Hep B can be fatal. It causes severe damage to the liver. But again, just be aware of body substance and body substance isolation. TB, really, they thought TB was gone. And then all of a sudden it made its way back. The same way with measles. They thought measles was gone, but they made its way back, right? So be aware of that. I read an article one time that 75% of all homeless people have active TB. Not TB. Homeless and having TB, possible. But TB, tuberculosis, which is an airborne virus, 75% we're not going to treat that homeless person any different than we would the gazillionaire, right? We're going to treat them the same. So, but you need to be aware. Don't get in front of their face. Stand to the side. If they have night sweats and really mucus cough, maybe coughing up some blood, they need a mask. You need to put a mask on them. You can come in contact with TB in an elevator. So, someone sneezes right before they leave the elevator, you get on the elevator, right in passing, those airborne droplets are still in there. So it's not a big thing. Just because you come in contact with TB doesn't mean that you're going to get tuberculosis. But our protection, we use face mask, or if for sure that they have TB, we would use this HEPA mask, the N95 HEPA mask. That's important. Put a star by that. Okay. Meningitis is another thing. I've had meningitis before. Not fun. Inflammation of the lining of the brain and spinal cord. If it's the lining of the brain, it's called encephalitis. Meningitis usually deals with the spinal cord. I had both. I had spinal meningitis and encephalitis. Right? It just worked its way up my spinal cord. The thing here is, like when you guys go to college and you live in the dorms, you're going to get a meningitis vaccine. You have to. To live in the dorm, you have to have a meningitis vaccine. I don't see why they don't give it here. You guys are much closer proximity here than you are. They should make it for public school. But meningitis is one thing to look for. We'll talk about meningitis a little bit later, how they do the test. They do a spinal tap to test to confirm it. But if someone's having a high fever and a stiff neck, like they can't touch their chin to their chest like this, okay, it's one of those telltale signs that they could have meningitis. All right, so right quick, let's finish up. Infection control, your responsibility. Wash your hands. They're infection control nurses around the hospital. That's going to keep you honest with yourself about washing your hands. You go in the room, patient's room, you use the hand gel or wash your hands when you go in. You leave the room, use the hand gel, you wash your hands when you exit. Right? You never leave the room with the exam gloves on. You dispose the exam gloves as you leave. Okay? And then wash your hands in and out. So it's important for us not to be the carrier, not to spread the infection. And we'll talk about if you come in contact with body substance, isolation, and a little down the road a little bit, okay? There's a procedure that is put in place for your protection. Again, we've never had that happen, okay? So, but there is a procedure in place we'll talk about. But make sure that you keep yourself safe, okay? The healthcare providers at the hospital is also there to make sure that you keep safe. But sometimes it gets a little crazy. Right? People get out of control in the emergency room or wherever, right? So make sure that you are safe. If you don't feel safe in the room, don't go in. Okay? Trust me, if I'm the healthcare provider and I'm there with you, I'm going to make sure that it's safe for you to go in the room. I'm not going to take you in an unsafe environment. Okay? And these are things that, as we get closer to going to the hospital, we'll talk about more and more. All right? Make sure that you're safe and that you start developing a situational awareness to you. All right? I don't really believe that you guys have a good situational awareness yet. Some of you may not. But I say that because I can't do it now because everybody's like looking, wondering what I do. But a lot of times I can get really close to you, like behind you. I mean, I can get like right here, and you don't know that I'm there until you turn around and go, right? You know what I'm talking about? If you had good situational awareness, you would know that person is that close to you. Now me, as a healthcare provider, I don't have this bubble that you guys talk about. I don't have a comfort zone. You would have to crawl inside of me to find my comfort zone. I don't have one. Okay? That's just because I'm used to working with people. I'm used to being close in contact with people. But you need to be aware that someone's there, and that's through situational awareness. The same way that you feel like you're in danger, you have good situational awareness. All right? Work on that. We'll work on that through the time. Okay. You don't need to take notes on this.